Hello, my name is Dr. Dewan as Raja. Today I will discuss about post-traumatic stress disorder, also called PTSD. Post-traumatic stress disorder is a mental health condition that can develop after experiencing or witnessing a traumatic event. It affects people who have been exposed to situations that involve actual or threatened death, serious injury, or sexual violence like rape. These events may include combat, natural disaster, accident, abuse, and other life-threatening events. What is the neurobiology of PTSD? PTSD arises from complex interaction between brain, nervous system, and stress response pathway. PTSD is characterized by dysregulation of body system responsible for processing fear, memory, and stress. Okay. In PTSD, the amygdala becomes hyperactive. Amygdala is a part of limbic system. It is located in the temporal lobe of the brain, leading to heightened fear responses and difficulty distinguishing between safe and threatening situations. In PTSD, the prefrontal cortex of the brain becomes hypoactive, resulting in reduced control over amygdala and impaired regulation of fear responses. In PTSD, the hippocampus tends to be smaller in volume and less active, impairing memory function, contributing to difficulty distinguishing trauma memories from current experiences. In PTSD, dysregulated cortisol level, either too high or too low, impair the ability to terminate the stress response, leading to chronic hypoarousal and increased sensitivity to stress. That means the axis between hypothalamus pituitary adrenal cortex, the axis is disrupted, the feedback is also disrupted. In PTSD, overactivation of the systemic nervous system, sympathetic nervous system, to hypervigilance, exaggerated startle response, and persistent state of arousal. So, overactivity of the sympathetic nervous system. That's why blood pressure increases, pulse rate increases. Okay, we got that. Symptoms. PTSD symptoms typically fall into four categories like intrusive thought, flashback of the traumatic event, disturbing memories or dreams, emotional distress or physical reaction, that is, heart racing, sweating, when reminded of the trauma. Avoidance, avoiding places, people, or activities that trigger memories of the trauma, avoiding talking or thinking about the event. Symptoms. The third symptom, negative changes in thinking and mood, persistent negative emotions such as fear, guilt, shame, feeling of detachment or estrangement from others, difficulty experiencing positive emotion, negative beliefs about oneself or the world. Arousal and reactivity, hypervigilance, always being on guard, exaggerated startle response, irritability, aggression, or anger outburst, difficulty concentrating or sleeping. What are the risk factors for PTSD? While not everyone who experiences trauma develops PTSD, the likelihood can be influenced by severity of the trauma, personal history, that is childhood adversity, prior mental health conditions, lack of social support, neurological or genetic factors. So, diagnosis. PTSD is diagnosed when symptoms persist for more than a month, causing significant distress, interfere with daily functioning. It is assessed by mental health professionals using criteria outlined in diagnostic manual like the DSM-5. Treatment of post-traumatic stress disorder. This includes psychotherapy, particularly cognitive behavioral therapy, help identify and change negative thoughts. Exposure therapy, gradual exposure to trauma, reminder to reduce sensitivity. Eye movement desensitization and reprocessing, EMDR, uses guided eye movement to process traumatic memories. Medication, okay. Antidepressant, that is selective serotonin reuptake inhibitor like sertraline and paroxetine, are FDA approved PTSD. Other medication may be prescribed based on the symptoms. Treatment continued, lifestyle and support, building a strong support network, stress management technique. There is mindfulness exercise, group therapy, connecting with others who share similar experience can help. Okay, so coping strategies for post-traumatic stress disorder, educating about PTSD, practice self practicing self-care, healthy eating, regular sleep, exercise, seeking professional help early, staying connected with trusted friends or family members. And that's all about the post-traumatic stress disorder. If you have any question, please feel free to ask me. Please share the information with your friends. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.